Hello, this is Dr. Lewerenz, Longevity Health Institute, and I want to share with you something here that it's a very, very simplistic thing. So I thought I would break this down, and it's kind of like going backwards to your health, to something so simple, but that can impact you so meaningfully if done right and if appreciated. And when you see us here in a functional personalized medical model, in looking at root causes of things and really looking at you as a whole, these things and things like this don't get missed. So just a quick review, what do we do here at Longevity Health Institute here in southeastern Michigan is we get to the root cause of things. We always are focusing on a 6-point model to make sure that you get the best in wellness and preventative medicine, okay? And you fix things. How do we thrive? How do we build immunity? How do we stay vibrant and strong and energetic? Is that we have a good foundation, a good health system that actually is in us. And that's what we do here at Longevity, okay? But there's one simple thing, and if you do this one thing, and you can do it anywhere, of course, our doors are open to you, and we see a lot of new patients here and really love impacting their lives and changing the trajectory of their health overall. And that just feeds itself. But if there's one thing that you can do, it's improving this vitamin, and in a very specific way, and I'm going to tell you in 1 second. Our 6-point model is this. We always look at genetics, we look at root causes of imbalances of hormones, digestive health, and your health system in your gut, and appreciate that very, very, very in detail, how you detoxify and how your liver and kidneys detoxify and filter, common stress and body, brain, if you will, connections, stress factors, and then structural, anything structural. I mean, down to your spine, to your bones, to your anatomy, to actually things that structurally change with age, which are normal aging, but something that needs to really, really be evaluated and understood and often gets overlooked, and that is structural changes in the body, okay? So what is this one thing that we can make a difference and really change somebody and improve their energy, their nerve conduction, open their brain a bit, improve signaling, and help so many other systems that are part of like detoxification and how your liver works, and is a cofactor in so many processes in your body, and that is your B12 and B12 status, okay? Now, B12 is a water-soluble molecule, but actually just optimizing your B12 can help so many things in your body. And let me tell you, it's very, very common to develop B12 deficiency with aging because a antibody, that's an autoimmune type of reaction that can get and develop in your body that blocks intrinsic factor so that you don't bring in and absorb B12 to your system and get in your cells. And so your red blood cell or your microcytic, if you will, cellular level of B12 is depleted, or if you will, deficient or insufficient, okay? B12 is so key. So many people get overlooked when their serum B12 is actually in the quote-unquote reference range. Now remember, I told you this in other videos, and I've stressed so many times, reference range is just statistical. It's statistical things that doctors are supposed to really look at the labs and kind of, if you will, appreciate, but it doesn't mean that you're normal if you're in the reference range. So whether you're talking about vitamins or hormones or you know, minerals or anything, you have to make sure that you understand what reference range is. And many people have B12 levels in their serum that is 200, 300, 400, and then at a cellular level, they're very deficient, okay? So, you know, how do we here impact somebody is it really, one, make sure that they're absorbing B12, that they're getting the best type of B12, and 95% of the time, methylcobalamin, the methyl subtype of your cobalamin, which is B12, is actually a better carrier and also treats and, if you will, bypasses a very common 70% of the population genetic SNP that is called MTHFR got other videos on that you can reference and kind of watch. And I encourage you to watch and listen to something about MTHFR. But listen, it's just so important to get the methyl 90-95% of the time type of B12, okay? Always you can get a methylated B12 injection, and that'll bypass actually your gut and absorb it. We do IV therapy here in the office that always gets to your system and gets you built up well. B12 is water soluble, so really in the big picture, it's very hard to get toxic B12 levels. In fact, many people feel better, function better, if you will, and really do really well on sometimes replacing B12, whether it's intravenous or injectable several times a week. Okay, but those higher thresholds of the B12 actually can help so many conditions and literally improve energy, mood, brain function, detoxification, nerve conduction. Really helps immensely in neuropathies. But I'll tell you, I have a lot of patients visit one when we capture that and we improve their B12. Many things improve. So always get that checked and appreciate that and make sure that that level actually is more optimal and not just in the reference range. Okay. The other thing is why, besides that autoimmune condition that actually blocks your absorption, that intrinsic factor abnormality, why else could you have low B12? Well, obviously diet, okay? So we see this sometimes in vegans or, significant, very strict vegetarians, but vegans, you have to really watch for it. The other people that you have to watch for it is as you age, this is a bit more and more common. And the other reason is digestive health and digestive lining. In fact, we do here every day, all the time, day after day, follow it yearly in patients that we've seen for decades, and that is their gut health and their gut lining and how they absorb. And that is a system that I promise you, it's not a good promise, always ages and gets worse with aging, chronological aging. So if you don't have a good diet or you don't have good gut health, you will innately always develop malabsorption to some degree. Some people severe, some people more moderate, okay, or minimal to moderate. But get your B12 level up, which is going to improve energy, neurologic conduction, memory, mood, and so many other things, too many to list, and literally will really help you and impact you. Now here at Longevity, we always, like I said, check this in detail. If you're not coming here, but we always welcome you, see new patients all the time. My practitioners and myself, 2 locations, will always get your B12 level up. And if you're not coming here, have your doctor or your healthcare provider look at it in detail, understand why it could be low, and replace it. This is Dr. Lewerenz. Be well.